I had been trying to get into that clinic for 4 months, not because I was being unreasonable, not because the clinic was selective in a way that excluded me on paper, because I had been sick for 8 months and no one had yet been willing to take it seriously enough to refer me somewhere that could actually help. The morning I finally walked through the doors of Harmon Cardiology Specialists, I had driven 40 minutes, rescheduled twice because I had been too exhausted to drive, and sat in my car in the parking lot for 10 minutes working up the specific energy that getting through a door requires when your body has been working against you long enough that nothing is easy anymore. I did not look well. I am going to say that plainly because it matters for what happened next. I had lost weight I couldn't afford to lose. My color was not good. I was wearing clothes that were clean and pressed because I had made the effort, but they were hanging on me in the way clothes hang on a person when the body underneath has changed faster than the wardrobe has. I walked to the reception desk. A nurse, not a receptionist, an actual nurse in scrubs, who I later learned handled patient intake, looked up from the desk and looked at me. The looking took about 2 seconds. It was not the look of someone assessing a patient. It was the look of someone making a different kind of assessment entirely. She stood up. She walked around the desk. She positioned herself between me and the waiting room, literally, physically, with her body blocking the space between the desk and the door to the clinical area, and she said, in a voice that was not quiet, "You don't belong here. This is a referral-only specialist practice. Leave now." The waiting room had perhaps 12 people in it. All 12 of them were looking at me. I stood very still with my referral paperwork in one hand and my insurance card in the other, and I said, as evenly as I could, "I have an appointment. I was referred by Dr. Patricia Huang." The nurse looked at the papers in my hand the way someone looks at something they have already decided is not relevant. "I'm going to need you to leave," she said. I was so tired. That is not an excuse for what I said next, which was nothing, not because I had nothing to say, but because 8 months of being dismissed by people in medical settings had taught me that argument was not how this worked, that the way this worked was paper and documentation, and someone senior enough to override a frontline decision. I said, "I would like to speak with the head doctor." The nurse's expression said something her voice did not. She said she would pass along my request. She went back to the desk. I stood in the entryway with 12 people watching me and held the paperwork in both hands and waited. 4 minutes later, the door to the clinical area opened and Dr. Marcus Reed walked out. He was holding my chart. He looked at it for a moment. Then he looked up at me. Then he looked at the nurse. Then he looked back at the chart. His hands were not steady. Before I tell you what he saw, please take a second to like this video, subscribe to the channel, and tell me in the comments what country you are watching from. Now, let's begin. My name is Katherine Wells. I am 38 years old, and the 8 months before that morning were the most frightening of my life, not because of any single dramatic event, but because of the slow, accumulating terror of knowing that something is genuinely wrong with your body and being unable to find anyone willing to investigate it seriously. It started the previous October with fatigue, not the ordinary tiredness of a busy life. I was a project manager with 2 children and a full schedule, and I understood ordinary tiredness from the inside. This was different. This was the kind that sat in your chest like a weight, that made climbing stairs something you thought about before you did it, that followed you into sleep, and was still there when you woke up. I went to my primary care physician in November. She ran blood work. Everything came back normal. She said it was probably stress and recommended I look at my sleep habits. I looked at my sleep habits. Nothing changed. In December, the fatigue was accompanied by something new, a shortness of breath that appeared without warning, not during exertion but at rest. Sitting at my desk, reading to my children at bedtime, standing in the kitchen making coffee. A sensation of breathlessness that had no trigger I could identify. I went back to my doctor. She listened to my heart. She said everything sounded normal. She ordered a chest X-ray. The X-ray came back clear. She referred me to a pulmonologist. The pulmonologist ran lung function tests. They were normal. He said the breathlessness was probably anxiety-related and recommended I consider speaking with someone. I spoke with someone. The therapist was kind and the conversations were not without value, but neither of us could explain why I was losing weight without trying to, and why my resting heart rate had begun to do things that my phone's health monitoring flagged as irregular. By February, I had seen 4 doctors. By March, I had seen 6. The phrase, "everything looks normal," had become so familiar that I had stopped finding it reassuring and started finding it terrifying, because I knew what was happening in my body, and normal was not the word for it. The 7th doctor was Dr. Patricia Huang, an internist who had been recommended by a friend, and who had the specific quality of attention that I had been looking for in every previous appointment and not found. She listened for 40 minutes. She asked questions I had not been asked. She looked at the cumulative record of what I had been through and said something that I had to ask her to repeat because I had stopped expecting it. "I think you may have something that has been missed. I want to refer you to a cardiologist." The cardiologist she referred me to was Dr. Marcus Reed at Harmon Cardiology Specialists. The wait for an appointment was 6 weeks. I waited 6 weeks. I rescheduled twice because I was too exhausted to drive. On the 3rd scheduled date, I got in the car. And then I stood in the entryway with a nurse blocking the door and 12 people watching and the paperwork in my hands, and I asked to speak with the head doctor. Dr. Marcus Reed was 55 years old and had been practicing cardiology for 22 years. He told me this later, during the conversation that followed what happened in the waiting room, in the specific, deliberate way of a person who is offering context that they feel is relevant. He told me he had seen a version of my chart before. Not my chart specifically. A chart with the same pattern, the same sequence of symptoms, the same cascade of normal results from tests that were testing the wrong things, the same 8-month window of progressive deterioration while a patient was told, repeatedly, that everything looked fine. He had seen it once before. The patient had not made it. She had been 41 years old, and she had been dismissed by 2 emergency rooms and 3 specialists over 6 months before collapsing at home. By the time she arrived at Harmon, she was in acute heart failure. They had done everything they could. He had thought about her case every week for 3 years. He had written 2 papers about the diagnostic pattern that had been missed. He had trained his staff specifically on the presentation, the way this particular condition mimicked anxiety and respiratory illness in its early stages, the way standard tests failed to catch it because it required specific imaging protocols that were not part of routine workups. When my chart arrived at his desk that morning, transmitted electronically from Dr. Huang's office the previous week, he had flagged it immediately as a case he needed to see personally. He had not communicated this urgency to his front desk or nursing staff. He did not know that I had been standing in the entryway being told to leave for 4 minutes before he walked out. When he looked at the chart in the waiting room, he was confirming what he had already suspected from the records. What he was not prepared for was reading the nursing intake note that had been entered 2 minutes earlier. Patient asked to leave. Does not appear to be correct patient type for this practice. He looked up at me. He looked at the nurse. He looked back at the chart. His hands were not steady because of what was in the chart, and because of what the nursing note said, and because of the particular arithmetic of those 2 things combined. A patient who matched every marker of a condition he had dedicated 3 years to understanding, standing in his waiting room having been told to leave by his own staff. "Mrs. Wells," he said. Everyone in that waiting room was still watching. "Please come with me," he said. "Right now." He turned to the nurse. His voice was very quiet. "We'll discuss this later," he said. "Come with me, please." He held the door to the clinical area open. I walked through it. What Dr. Reed found over the course of that appointment, and the imaging that followed in the days after, was a condition called hypertrophic cardiomyopathy, a thickening of the heart muscle that had been present for some time, progressing slowly, explaining every symptom I had experienced and every test that had come back normal because the tests I had been given were not designed to detect it. It was serious. It required treatment. It was also, and I want to say this clearly as Dr. Reed said it to me, clearly manageable. With the right medication and monitoring, and in some cases a minor procedure, people with this condition live full lives. The critical factor is diagnosis. Dr. Huang had sent me to the right place. Dr. Reed knew what to look for. The nurse at the door had tried to turn me away 4 minutes before he walked out. I think about those 4 minutes often. Not with bitterness, exactly, though I will not tell you I feel nothing about them. I think about them with the specific attention of someone who has come to understand how close the margins are, How much depends on a referral from the seventh doctor rather than the sixth, on a physician who has written 2 papers about a pattern other specialists missed, on a patient who is too tired to leave when she was told to and asked instead for the head doctor. The nurse was spoken to by Dr. Reed, and subsequently by the clinic's medical director. I was told this by Dr. Reed himself, at my 3rd appointment, when he raised it without me asking. He said he wanted me to know it had been addressed, and that it would not happen again. He said it in the specific, careful way of someone who had been practicing medicine long enough to understand that the events that occur in waiting rooms have consequences that are not always visible from behind a desk. I thanked him. I meant it. Here is what I want to say to anyone who has been dismissed in a medical setting. Anyone who has been told their symptoms are normal or their concerns are anxiety or their chart is not serious enough for the room they're standing in. You are allowed to ask for the next person. You are allowed to stay when someone tells you to leave. You are allowed to hand your paperwork to someone with more authority than the person blocking the door and say, as calmly as you can manage, I have an appointment. I was referred. I would like to speak with the head doctor. It will not always work. I know that. The margins are not always in your favor, and the 7 doctors are not always reached before the situation becomes something else. I am not telling you a story about how persisting guarantees outcomes. I am telling you a story about what happened when one patient, on one morning, was too tired to walk back to her car and too certain that something was wrong with her body to accept the word leave from someone who had not read her chart. The chart told the truth. It told it to the right person. And the right person's hands shook because he understood, in the way that doctors understand things when the pieces come together, exactly what would have happened if I had walked out that door. I did not walk out that door. That is the whole story.